Today I'm doing a program on Parkinson's disease. A lot of people don't know about it or think about it because people that live with Parkinson's disease do live with Parkinson's disease. So it's not something like cancer treatment. You know, hope if you have cancer, you go in, you get treatment, you get radiation, chemical things that help you, and hopefully you're cured. But with Parkinson's disease, it's slow. People can live, and they live very well. But there are issues with it. And I think that's a good thing to talk about. How you get it, what the issues are, and how you continue to live. Now, there are more than 10 million people living with Parkinson's disease, and there is a platform for that. Notable people that have had Parkinson's disease want to share. That's something that's special because you may not know anyone that has Parkinson's disease, or you might. But these are people that shared and also when they were diagnosed. So I think that's really interesting. Muhammad Ali died in 2016, but he got it in 2000. Michael J. Fox was diagnosed in 1991, and he came out. He tried to help people to understand, I'm a well person. All of a sudden, I have Parkinson's disease. George W. Bush, 2012, was diagnosed. Neil Diamond was diagnosed in 2018. Billy Graham in 1993. He died of old age in 1999. Reverend Jesse Jackson was diagnosed in 2015. Ozzy Osbourne, 2019. Robin Williams, 2014. He was diagnosed in 2014. He lived 3 months with Lewy Body Dementia, which is a form of Parkinson's. So you see, it's been around. We know about it. But I also remember as a student nurse and as a nurse, really never caring for a person with Parkinson's disease because you can live a healthy life. There are stages which we'll talk about, but it's one of those diseases that really don't get a lot of notoriety. And that's why these people came forward to say, let's talk about it so people understand what the symptoms are and how they can continue to live. So I'm going to talk about what is Parkinson's disease. Now you tell me if I have to move over. Yes, I do. Can you see it all well? Good. Okay, what is Parkinson's disease? Scientists believe Parkinson's disease is a combination of genetics and environmental factors. So that in itself is something you don't hear about. Genetics and also the environment. Parkinson's disease affects about 1 million people in the United States. And I already mentioned 10 million worldwide. The main findings in people diagnosed with Parkinson's disease is loss of neurons in the area of the brain known as substantia nigra. That's where it happens. That's where it all happens. Substantia nigra, located in the midbrain, has long been researched as a site of the distribution of dopamine. Parkinson's disease interferes with this distribution. So in this first slide, we already realize it can be environment, it can be genetic. We also realize that there is something there that interferes. So maybe we can stop that interference. That's what the entire search to cure Parkinson's disease is all about. Genetics cause about 10 to 15% of all Parkinson patients. In ongoing studies also researching gene mutation of the disease. So there are research people going on to try to find out if we find the gene, the genetic, perhaps we can cure the disease. Statistics. I'm going to move a little bit. I hope she's going to be able to hear me. Okay, statistics. Who has Parkinson's disease in the United States? Nearly 1 million people will be living with Parkinson's disease by 2020. Nearly 60,000 people are diagnosed with Parkinson's disease each year. The incidence of the disease with age but it's estimated 4% are diagnosed before the age of 40. So here we're thinking about older people, but there are still diagnoses being done much earlier. The combined healthcare costs, both indirect and direct, estimated probably $52 billion a year. It is significant. Medication can cost an average $2,500 a year, and therapeutic surgery $100,000 annually for people that have Parkinson's disease. I already mentioned this statistics, but again, nearly 10 million people will be living worldwide with Parkinson's disease. The causes of Parkinson's disease, it's not well understood. It's not well understood because also oftentimes people get different symptoms. They don't have all the same symptoms. So it becomes a real search to find out what causes it, do you have it, and what symptoms are really determining the way you are, how you manage through your day-to-day life. Other factors may also include head injury, area of residence, and exposure to pesticides. These are three very important parts because you sort of could put a head injury in because you think somebody, we talk about football players when they're hit in the head. Well, we talk about that because it does affect their brain. We have people that have Alzheimer's disease, dementia, as a result of the Parkinson's disease. So it's a noted combination of factors may cause the disease, and that's what we are going to talk about. The gene alone may not cause Parkinson's disease. 10 to 15 persons affected with Parkinson's disease may have the gene. May, again, it's that, may have the gene. Not everyone will experience symptoms in the same order, nor with the same intensity. So you're getting that feeling that, well, people are getting it. They're probably going to the doctor a little bit late because they really don't know what they have, ache or pain, something that would really cause them to go to the doctors early on. Can you all hear me okay? And you can see this. Okay, this group is good. I hope everybody else can see you if you're online. Welcome aboard, and we're just working together to understand a little bit more about Parkinson's disease. The cause of Parkinson's, some people have the genetic makeup that makes them more vulnerable to the disease. It doesn't say it gives them the disease, but that genetic makes them more vulnerable. A head injury, we already talked about, that traumatic brain injury, which results in an injury that may alter the level of consciousness that has been associated with increased risk of Parkinson's disease after injury, but the mechanism or developing Parkinson's disease is unclear. So if you are that football player and you're getting hit several times, they can say, these are the symptoms, but when we do a CAT scan or this, it doesn't show up the same way that other people with Parkinson's disease show up. The area of residence, I think, is just so interesting. There are differences in the geographic distribution of Parkinson's disease. This may be due to environmental risks and genetic factors. Again, they're tying the geographic risk with genetic factors, and there are geographic risk groups, and we will talk about them. Exposure to metals. Occupational exposure to metal has been suggested, but long-term exposure has been inconsistent. So you can be working in a factory and you're exposed to metal and everybody's fine. All of a sudden somebody gets it. They look at that person, they find that person has Parkinson's disease. Well, where do they live? Do they live in the geographic area that may have caused this, or it is his workplace? So there's a lot of investigation. It's just not going to the doctor and they say, with your symptoms and your test results, I think you have Parkinson's disease. It's a real search to determine the cause. This is pesticides and herbicides. There is a strong link between Parkinson's disease and pesticides and herbicides. It has been researched and it has shown that there is a link between pesticides. The herbicide paraquat has been linked to Parkinson's disease. Paraquat is used widely for commercial use in the United States. It is banned in 32 countries, including the European Union and China. The Parkinson Foundation, along with the Unified Parkinson Advocacy Council, sent a letter to the United States Environmental Protection Agency, EPA, to cancel the use of paraquat, as there is strong evidence and research linking paraquat and Parkinson's disease. October 2020, the EPA reapproved the use of paraquat for the next 15 years. Now, I know you see commercials about this on television. They talk about paraquat. They talk about it's linked. And the EPA continues to keep it on board for the next 15 years. So that would be 2035. So it's very hard to understand the research, the fact that people don't get involved and say, we know it may be one of the pesticides or herbicides that causes the disease. Other risk factors: age, largest risk factor for developing Parkinson's. 1% of the people over the age of 60 may have Parkinson's disease. Again, that's significant. 1% of all of our community may have Parkinson's disease. The gender, it is more prominent in men. They don't know why, but it is more prominent in men. Signs and symptoms. I think this is so significant because it groups everything that you may have if you have Parkinson's disease. Signs and symptoms are or may be different from person to person and usually develop over time. Again, you go to the doctor, you might say that when I get up, start to walk, I'm either dizzy or I just feel like I'm going to fall. Okay, that might be something. It could be nothing. Doctor will say, well, have you fallen? No, I haven't fallen yet, but I'm scared. I'm afraid I'm going to fall. So they may do a series of studies to make sure nothing's wrong with you, nothing's wrong with the brain. They're really not connecting Parkinson's disease at that point. Many older adults, and one of them, have gone into the doctor and said, I get these dizzy spells. Well, they're not going to put a diagnosis on me. They're going to treat the dizzy spell, find out what is causing it. Tremor, noted in the fingers, chin, and thumb. Parkinson's is known for its movement. With Parkinson's disease, it's a movement disorder. So some of the things that happen are tremors in the fingers, chin, and thumb. Small handwriting. I have an article. Small handwriting and or change in handwriting, crowded words. When healthy living, handwriting improvements for people with Parkinson's disease. So if all of a sudden you start really writing very small, can hardly read it, that's an issue. And people that have that could be the first symptom, that small handwriting. So that is one of the symptoms. So I just happened to have Brain and Life, which I'm going to give you information about how to get this free journal. And it was in there. And it says that's one of the triggers. Unusual small handwriting. Signatures are not legible. Loss of smell. Well, actually, bananas do have a smell. I can't smell a banana, but loss of smell. Bananas, dill pickles, and licorice. So they're really trying to diagnose. Doctor might have these little tools in his office. Can you smell this? Well, I'm not big on bananas smelling it because to me they have no smell, but perhaps they do. Trouble sleeping, thrashing, sudden movements. We're getting to the movement part. That is very significant. Trouble moving and walking, stiff arms and legs, soft or very low voice, may sound hoarse, a masked face. That is significant. When you have Parkinson's disease, your face almost looks stone-like. And it isn't, but that's the appearance of it. You become dizzy, and that's stooped over position. So I would say for the signs and symptoms, movement is number one. Trigger. I'm not moving well. I'm stiff. I'm stooped over. I have different feelings like I'm going to fall or crash. Movement is significant for Parkinson's because, if you've seen anyone with Parkinson's, they do have a tremor. They shuffle when they walk. There are lots of things that happen, but it affects the movement of your body. When to see a doctor. I think that's significant. You see your physician if you have any of the symptoms associated with Parkinson's disease. So I talked about those symptoms. You know, it might be, you think, well, I just heard the, Jerry Cohen talk about my movement and I'm not walking as well, or I'm stiff in the morning. Well, if you're thinking something, go to the doctors and he'll say, well, let me just do other tests, and that's what they will do. But these symptoms creep up on you. So if you do have it, they confirm or rule out Parkinson's disease or other possible causes of those noted symptoms. Again, it's connected to the brain, so you want to make sure that everything is working properly. Researchers have also noted that many changes occur in the brain of people with Parkinson's disease, although not clear why these specific changes occur. And if I say it once, I'm going to say it many times. All of these things aren't clear, but also people do live with Parkinson's disease. That's a good thing. So I guess they're trying to figure out treatment as much as what causes this. Because if you're treated properly, if you need medication and you're given the medication, some people live to age 99 or more, 105. Hello, welcome. The stages of Parkinson's disease, significant again, because we talked about early on, but there are 5 stages of Parkinson's disease. Stage 1, during that initial stage, you're starting to feel a little bit uncomfortable. The symptoms are mild and generally don't interfere with daily life. They may make you think of something, but they don't interfere. Tremor and other movement symptoms occur in one side of the body. So if you're right-handed, all of a sudden you're starting to see your hands like shake a little bit. Well, you ignore it because you don't know what's causing it. But then you realize, well, there is something happening on the right side of my body. So stage 2, symptoms start getting worse. Tremor, rigidity, and other movement symptoms affect both sides of the body. So remember, the first side, you're just on one right or left side. Stage 2, your body is affected on both sides. Walking is problematic. Poor posture may be apparent. The person is still able to live alone. They still can do daily tasks. They become a little bit more challenging, but at this point, they're living alone. They can live alone. They can do their tasks, but their body movement is changing. Their posture is changing. Stage 3. This is considered mid-stage. You have loss of balance and slowness of movement are recognized symptoms. So loss of balance, and you move very slowly. If you were able to walk to this chair, normally you would walk to it. Could take you 5 minutes to get there because that's stage 3. Your movements are very, very slow. Falls are more common. The first 2 stages, you're really working hard not to fall because your brain is saying, don't fall. Your body is telling stage 3, you might fall. You have to have a plan in case something like that happens. The person is still considered independent. They can still live alone, but symptoms significantly impair activities such as dressing and eating. So stage 3, you're becoming more aware the things that you can do and the things that you cannot do. Stage 4, at this point, symptoms are severe and very limiting. It is possible to stand without assistance, but movements may require a walker. So you can probably get up, stand up, probably can use your walker to stand up, and then you can use the walker to walk. But at this point, you're becoming almost immobile. Person needs activities of daily living and is unable to live alone. Remember I said people do live longer, but they have to make changes in their lifestyle. The person needs assistance with activities of daily living and again, unable to live alone. Stage 5, this is the most advanced and debilitating stage of the illness. Stiffness of the legs may make it impossible to walk. The person requires a real wheelchair or can be bedridden. Around-the-clock nursing care is required for all activities. At this stage 5, the person may start hallucinating and delusions will happen. During this stage, there are many significant motor and non-motor symptoms occurring to devastate both patient and family. There are a lot of advertisements for Parkinson's disease. If you recall one, a gentleman is outside on his property and he sees people, hallucinations, and he doesn't know what it is. He's frightful. His wife knows he has Parkinson's disease, tries to calm him down. So these are real symptoms that happen to real people and their families. Parkinson's is called a movement disorder. We talked about that earlier. Dopamine is a chemical messenger that is responsible for controlling movement, emotional responses, and the ability to feel pleasure and pain. When you have Parkinson's disease, dopamine is definitely affected. The symptoms are different from person to person and develop over time. Parkinson's disease is called movement disorder because of the tremors, the slowing and stiffening movements, the tremor, rigidity, and postural instability and stooping. So when you have Parkinson's disease, definitely a movement disorder, the dopamine, a chemical messenger in your body, in your brain, cannot connect the neurons. The dopamine is stopping that connection for Jerry to get up and to walk. So it's in your brain. The dopamine in your brain has lost that ability. Yes.
I guess I was just thinking, how about eating or went to the bathroom or stuff like that? I mean,
well, in the later stages, everything is affected. So if you are, in bed and bedridden, eating becomes a problem. Definitely, sometimes tube feeding is required. But in stage 5, families and the person, they've made their feelings known. They've done their living will, because Parkinson's does not go away and there is no cure. So your doctor will probably talk to you about the stages. And when you're, not to be negative, but you should have that talk. This is what happens. You could be in stage 1 and 2 for years. So we don't paint the negative, but be prepared. And that's what that stage 5 is. By that time, you are prepared, your family are prepared. Emotionally, you're not prepared, but that could happen. Additional movement symptoms. You can have cramping. I don't know if has anyone had a family member with Parkinson's disease? Okay. So some of these things are resounding with you.
They're humped over.
Huh?
The spine is blocked. And she talked about the dopamine, and she's on a drug. She has made a world.
Good.
So she's been able to do much more.
Oh yeah, there are several drugs that we will talk about, and it has worked, and that's a good thing. Early on, they did have various medications, just like Alzheimer's. They were giving the same medications since 1906, when Dr. Aller's Alzheimer's decided this is the disease, and they called it Alzheimer's because of Dr. Alzheimer's, up until, I would say, 2015. Those same drugs were given. Now there are breakthroughs, and breakthroughs need to happen, but they happen slowly, especially with these neurological issues. So yes, thank you for sharing that. So the drooling is apparent. Dyskinesia, which is involuntary, erratic writhing and moving with arms and legs. They might kick their leg up, move their arm. They cannot control the movement. Fascination is short, rapid steps taking during walking or falling. That dyskinesia is just like, they shuffle. This is how a person with Parkinson's disease walks at these later stages. But you could see if you're walking that way, you are really prone to falling, because that's not a normal, or you could trip or something. And on this carpet with these shoes, boy, I couldn't do that long, because I would trip. So falling is just so significant. The freezing appearance of being stuck in place, especially when initiating a step. Turning, navigating through doors becomes so challenging. Bradykinesia is slow movement. So as you progress in the stages, one of the symptoms is bradykinesia, and it just means a slow moving person. and they kind of stop. They stop in their movement. So they could just be walking. They see this chair, they want to sit down, and they may just get so far, and then they stop. Their brain is not telling them right foot, left foot. Non-movement symptoms. Well, certainly there's anxiety. Breathing and respiratory symptoms occur. Cognitive symptoms are there, almost like a dementia type situation, because number one, it's affecting the brain. They don't know what part, they don't know anything about it, but there are cognitive symptoms with Parkinson's. Depression, talked about the hallucination and the delusions. Urinary incontinence, speech and swallowing problems, talked about that, about food and eating and swallowing. It affects every part of the body. Pain, skeletal and bone issues. So these non-movements are really connected to the entire body. So you do become, in the end stages, needing help 24/7. But again, remember the list I read in the beginning. Look how many people have lived with Parkinson's disease and lived well. So it's one of those dichotomies. You can get it, you can live well, you can stay in stage 2 for a long time. Pope John, he had Parkinson's disease for 25 years and it was working the whole time. So it's just some people get it differently than others. Treatment, medication to help the tremors, that would be a good thing, and they have that. Medical marijuana does work. It works to calm the person down and it helps with the tremors. Always physical therapy, occupational therapy. And there are so many clinical trials out. Clinical trials are done. You need a large group of people to do a clinical trial. With Parkinson's disease, they can have more clinical trials than with Alzheimer's disease. Because what do you need? You need a large number of people, and you need, because they could say from the start of Parkinson's disease, you were in stage 2 for 10 years. That was wonderful. And all of a sudden you started to, go into stage 3, stage 4, stage 5. With Alzheimer's disease, your life expectancy from time of diagnosis to the time of death is about 6 to 8 years. Now, things have changed there. There's a new drug out for Alzheimer's disease, but what they're saying is they don't have the number of people to make it easier to find out during a clinical trial what medication would work. But with Parkinson's disease, they're better because they do live longer lives. So that's all good. Here are the medications to support Parkinson's disease. Levodopa was the first medication for Parkinson's disease in the late 1960s. It's still the most popular, the most guaranteed drug because it does stop the tremors. It does help the person with Parkinson's. Noted as the most important breakthrough in United States history, and that was in 1960. So there was a breakthrough for Parkinson's. People really celebrated because it helped them with the tremors. It helped them in their relaxing when they had to sit, when they had to walk. It wasn't a cure-all. All it did was relieve the rigidity of the person's whole body. The side effect, though, of levodopa caused some nausea and vomiting. Well, if you have nausea and vomiting every day you take a pill, you don't want the pill anymore. So they did research, and to ease that, they gave, for the nausea and vomiting, a drug called carbidopa. And it was given, and it worked. So they could take 2 pills. They could take levodopa in the morning, maybe the nausea and vomiting at night, but it was working. The person felt more comfortable. They didn't have the nausea and vomiting. So all of a sudden, they decided to combine those drugs. So now you're only taking 1 drug. And that combination was the new drug called Sinemet. And that has worked wonders for people with Parkinson's disease. It is 1 drug, and it's been through clinical trials. It works very well. Sinemet became available in a range of doses and types of tablets. They have release tablets, controlled release tablets, orally disintegrating tablets, enteral suspension via tube feeding. I mean, they've everything, any way you can take this drug, it will go, especially in tube feeding. Because what it does, it relaxes that movement, and along with the relaxation of the movement, it reduces the nausea and vomiting. So for people with Parkinson's disease, this was just absolutely wonderful. I'm taking a breath. Woo-hoo. Now, this is something new. Not when I do PowerPoints and research, every time I do it, I research to find out, is there anything new out there? There's something called off episodes, OFF. Patient is being treated with levodopa, but there are times when more is needed. So they're getting levodopa. It is relieving the stiffness. It's relieving some of the falls, but the patient is off, may not walk or stand. And that's why it's called off episodes. The person with Parkinson's disease, they don't want to do it. They don't want to walk. They don't want to stand. They're rigid. So they call them off episodes. Off episodes, they don't happen often, but when they happen, the caregiver and the person that has Parkinson's can't take the next step. They just can't. So, and it's always with movement. So you don't have this off when you're just sitting down because you're okay, but you have it intermittently, this drug, when you're walking and all of a sudden you stop. You can't sit, you can't move forward. Let's say you live alone and you're okay to live alone, but now you have something different and it's called off. This was new. I'm not sure about the date or time, but it is FDA approved. So anyway, off episodes had to be addressed, and you're managing well. And you realize that you can have Parkinson's, and all of a sudden you changed your symptom, and it's called off. That's not unstable. Let's get down here. Oh, I'm going to go back. They have a new medication. It's called Apokyn, APOKYN. It's a new medication. It is FDA approved. It is new, and it's prescribed along with levodopa when the patient is off. So in other words, you're taking levodopa, everything's going well. And then you or a family caregiver or a caregiver says, I don't know what's wrong with Mary. She gets up and she's walking like she always does, and she just stops. So they said, well, can she do anything? No, she just stops. Whatever she was doing, she could have been getting into the bathtub or shower, and she stops. So they called it, it's like an odd name, but they call it off. And they did some research and they found this Apokyn. It's approved and it's in combination and assists the person during daily activities and prescribed for immobility. It's not given every day because most of the time that person is really doing well. But when this stops, just like with the off, they try it. Let's give off when this happens, and it has worked. So this is a new drug, Apokyn. The combination assists a person during the daily activities. So if you call the doctor and say, I don't know what's wrong with my mother. She never did this before. She wants to have a shower, but she just stops and I can't move her. And it's called off. Something triggers in her brain to just, that dopamine has just stopped. Totally. Dopamine still travels in the bloodstream, but when this off is there, it is just off. So this may be prescribed intermittently. As I said, person's fine, walks fine, and all of a sudden this off comes in. So it's not something, it's a symptom that comes and goes. Let's put it that way. This may be prescribed intermittently, as I said, or when they're experiencing episodes. Another treatment is called deep brain stimulation. And this is a surgical treatment for Parkinson's. It's like a pacemaker to your brain. So every time you're experiencing an episode of the movement disorder, that deep brain stimulation will probably do something to the dopamine, have it go through normally, and all of a sudden you're walking again. So it is called deep brain stimulation, pacemaker for your brain. They have to implant electrodes that modulate activity in targeted regions of the brain to alleviate specific motor symptom. It is not a cure, but as research, it's a strong therapy. Okay, the medication that we were talking about is new, approved by the FDA, and it's called Apokyn, Apokyn. It is used when a person really is not stable. They are perhaps in level 3, they cannot move, they're walking, and all of a sudden they're in that off position. It might be a good time to use Apokyn. So that's what it is. And again, it is Apokyn. It is new medication and it is approved by FDA. But it's really good for people that are not able to move forward. And that's why it's so useful. Yes.
They said my sister is doing much better with the medication. Is there a limit to that, or will it keep her stable?
But do you know what she's on?
Yeah, I wanted to ask about this.
Okay. I would say most people that are, the question was on your medications, if you're on it, will it keep you stable? So most of the medications you can stay on because they work. There's no increase in dose, but they work. And the doctor is going to keep you on that medication if it's working. So I would say there might be some new changes, just like if your sister had those moments where she can't move, she just stands there, then maybe they would look at these other medications that are new and through clinical trials. And that one is Apokyn, and it's really for that person that isn't moving.
But she knows she goes to more and more. So I'm just wondering, if you just count on that definitely.
Yeah, I think a lot of people that are taking the medications for Parkinson's, that is their regimen. And nobody's going to say, well, you're doing so well, we're going to take you off, because they're not going to hurt anything.
Right, and it is like after 2 or 3 years, that doesn't work anymore.
No, it's almost like the medications for Alzheimer's disease. Basically, there is medication for it, and it works for 6 months. So you have Alzheimer's disease, you have your medication, Aricept, and oh wow, family says she's so much wonderful, we love it, but it only lasts 6 months. And that's, you're told that this is going to help your brain, but it's not going to continue. Most family members will say, please keep my mother on it. And the doctor says it's not going to help, but look how much better she is. So they keep the person on it. It's not hurting that person, but the family says it works so well. But after 6 months, it's for the Alzheimer's drug, it's really not doing anything more than it did the first 6 months.
You're saying with Parkinson's, that's not the case.
Right.
Stay on it, you stay in the same type of condition.
Right. You can stay on it. It works. It's proven to work. It's going to, help those movements. There might be other drugs that come out. They'll say, you've been taking levodopa for X number of years. Now we want to try something new.
It's not like she's kind of on stage 3 or
No. Those drugs are, when they're prescribed for the disease, and they work for the disease. Are there any other questions out there? Yeah, sure. The question was, when you have Parkinson's disease, are there places that you could live safely and still live a good life? And most continuing care retirement communities will certainly support you. So the question was, since I work at Cathedral Village, how does that happen? So you generally come in independent, and then there's another level. Let's say you're independent and you no longer can, you no longer can do all of your personal care services for whatever reason. And then there's a whole wing just for personal care in the same continuum. And then if you need more service, then there's another area. It's called memory support. And that would be if you had Alzheimer's disease and you needed a little bit more support, they have a unit for that. And then they have skilled care. So if you need more care than that, you go into skilled care. which is so nice. That's why CCRCs, continuing care retirement communities, are so nice because you don't have to move from the facility. So they take care of you at any level that you need.
So it moved me to start investigating names of such community in the area.
Right. Well, I have some, there are so many places you can, all you have to do is go online and click independent living, and you're inundated how many are in this area, and we are blessed. And I have some information about Cathedral Village, so at least you know what they offer. Any other questions? Well, I have some handouts for you. Thank you all, those of you that were not in person. Thank you all for coming.